Good morning, everybody. Today's hearing is the first of two hearings, which works out very well, the setup of the two hearings, that we're holding to look at deceptive payment practice that the health insurance industry has gotten away with for the last decade, probably longer. The victims of this deceptive practice were probably most of the people sitting in this hearing room today, along with the more than 100 million Americans who pay for health insurance coverage that allows them to go outside of their provider network for, medical care. Having the ability to get health care service outside of the network is a very important option for American consumers, and it's an option that they pay for, and they know they're going to pay for that, in the form of higher premiums, higher deductibles, and higher coinsurance payments. Now, Dr. Jerome should be sitting here today. Dr. Mary Jerome, she's a resident of Yonkers, New York. She's been fighting ovarian cancer since 2006. She had planned to be here, but she just can't physically make it today. But I'm still going to say something about her. According to her testimony, Dr. Jerome received her health care coverage through a point-of-service plan, which encouraged her to get care within a provider network, but also allowed her to see out-of-network providers if she so desired and if it was necessary. So here's what she says in her testimony. I had always been confident that paying for the out-of-network option provided peace of mind with respect to the financial burdens associated with the catastrophic medical costs. After her cancer diagnosis, Dr. Jerome and her in-network primary care physician decided that she needed to be treated at a health care provider that was outside of her network, that one being at Sloan Kettering Memorial Hospital in New York City. Dr. Jerome knew she was going to have to pay some portion of these costs out of her own pocket, but she also assumed in good faith that the treatment was going to be covered by her insurance. What we're going to learn today is that American consumers like Dr. Jerome, people who have been paying higher premiums for the choice to see out-of-network doctors, have not been getting what they have been paying for. We're going to hear testimony suggesting that the health insurance industry has been systematically lowballing American consumers. And this is a very upsetting situation, one which has been revealed in New York, and if we have to have 50 hearings for 50 states, I'll be glad to do that too. They have been promising, these insurance companies, to pay a certain share of the consumer's medical bills, but they have been rigging health care charge data to avoid paying their fair share. The result is that billions of dollars in health care costs have been unfairly shifted to Dr. Jerome and millions of other American consumers like her, as I said, probably many in this room. So here's how it works. The insurance company generally promises to reimburse out-of-network medical services at what they refer to in the industry as the usual, customary, and reasonable rate, usually just the word usual and customary. Well, the problem is that it's been the insurance industry who has been deciding what is usual, customary, and reasonable. What that means, they make that decision. Consumers have not had any input. Doctors and other health care providers have not had any input. The chairman of the American Medical Association has not had any input. Only the insurance companies have been getting to decide what's reasonable, which is like letting the fox define usual, customary, and reasonable in the hen house. You understand that?
I do. We have both in Missouri, fox and hen house.
So the good news is that thanks to a series of lawsuits and a year-long investigation by the New York Attorney General's Office, the insurance companies that operate in New York, including, most importantly, United Health Group and its medical information subsidiary, Ingenex, have been forced to change the way they do business. And Ms. Lacewell has a lot to do with that. Conclusion. Our goal for today is to get an update on how the reforms proposed in New York are being implemented and to understand how the deceptive practices uncovered in New York have been harming customers in the other 49 states. I'm looking forward to this testimony, especially at a time when our country is going through all kinds of murderous economic situations for people to pay any kind of health insurance at all. I would finally like to note that missing from our hearing today is one group of stakeholders who played an indispensable role in creating and perpetuating this unfair reimbursement system, but who will also play an essential role in changing it, and that is a little group called the insurance industry. On March 9th, I invited the CEOs of United Health Group and Ingenex to testify at this hearing because we wanted to hear their side of the story, because we're always fair here. Because United Healthcare told us that their CEO, Mr. Stephen Hemsley, was not available to testify today, we agreed to hold a second hearing next week. So that we're going to do on Tuesday. That's very important for observers and for press and for members here to know that. It's perfect. We have the good guys and then we have the other guys. The good guys are today. The other guy you're going to set up next Tuesday. So at 10 a.m. next Tuesday, we'll be holding a hearing during which we hope to gain a better understanding of the insurer's perspective. Now, this